Hey everybody. So for those of you that are new to my page, I was diagnosed with young onset Parkinson's disease in February of this year. But professionally, I am what's known as a certified professional in healthcare quality. Professionals in healthcare quality, basically we specialize in improving processes, among other things. And one of the core beliefs in quality management that we're taught is that variation of any kind is the enemy of quality. What that means basically is that it's always best if we can standardize practices, if we can find things that work really well through research and other forms of data and information and say, okay, this is the best way to do this, and let's make everybody do it this way. It's not as effective as we'd like in healthcare because there is a portion of healthcare which is considered an art form, really, and I think that's true. But as much as possible, we try and always advocate for standardized processes. The problem that I've been having since I got diagnosed and became a patient with Parkinson's is that there does not appear to be any clinical guidance or best practices that surround young onset Parkinson's disease. Now, I understand that this is a clinical diagnosis, that it's based in a large part on clinical observations. But frankly, based on the conversations that I've had with other people like myself and my own experience, it's become really obvious that there is just so much variation in this disease. Everybody's journey to the diagnosis is crazy and loop-de-looped roller coaster rides. And then once we do get diagnosed, what happens to us when we're told, what happens to us afterwards, just is totally different from person to person based on a lot of different factors. And as a quality professional, that really irks me. So I started to look and see if I could find what we have in a lot of other chronic diseases, which are just clinical guidelines that are issued by the organizations that are usually responsible for the research that's done in that field. For Parkinson's, that I believe is the American Academy of Neurology. And it does appear that they have in the past had Parkinson's clinical guidelines. It looks like they got pulled in 2020, which may mean that they're just in the process of developing new ones, which would be awesome. They also do have specific guidelines on the use of dopaminergic agents, which is just a fancy word for our medications, and that's great too. But I think as people with Parkinson's, it's really important that we advocate for these tools that other diseases have, and clinical guidelines are among them. I was fortunate enough to go to Mayo and see a movement disorder specialist that asked me all the right questions and did all the right things, and that's phenomenal. But I know that not everybody has that opportunity. And what I mean by that is he asked me about exercise. He asked me about my lifestyle. He brought up, my mental health and offered referrals for counseling and medication for depression and all those things. And we had a really great dialogue about that. But I don't know that everybody's doing that. And clinical guidelines help in that way, and that they really become reference for providers, especially those that may not see a lot of people with this disease. So I just wanted to take a minute to, ask people, first of all, have they seen the guidelines? Because I've seen them from the UK, I've seen them from Brazil, I've seen them from Australia and Canada, but I haven't seen them from the US, so maybe I just missed something. And secondly, if people would be, willing to advocate for something like that, especially based on recommendations on not just our medication therapy. I mean, obviously our medication is super important, but what the treatment would looks like for non-medication based interventions. So I know for myself, I think I'm probably going to ask for a referral to a speech therapist because my voice is just getting really weird. And I'm probably going to ask for a referral to occupational therapy. But things like that can be folded into therapeutic guidelines as recommendations, as frontline interventions for things like referrals to nutritionists or counseling services. But having things like that quantified in a accepted guideline from a reputable organization would really do a lot, I think, to standardize our treatments and improve our outcomes. Anyway, I hope this helps. Thanks.